want to welcome Commissioner Collins, Commissioner Ledford, Chairman Cry. I know Commissioner Blake and Commissioner Alford and Mayor Davis are here as well with us. We're going to say the prayer and the pledge. Commissioner Collins, if you would lead us in the prayer, and Commissioner Ledford in the pledge. Thank you, Commissioners. Need approval for the minutes, December 11th, 2023.
Second.
All in favor, say aye.
Aye.
Aye. Passes 3-0. Interim Director Lewis, it's nice to have you here with us today, and nice to have a lot of the staff from EMS here as well. Thank you all for being here today. We're going to start with old business, revenue loss report related to Digitech. Kind of give you the floor and let you speak. Guys, we are also, and I know some other commissioners are going to come and probably will have some questions. We have a large agenda today, and so there's a lot of things on these agendas. So if you do have questions, please pose them, and then we'll also have a time at the end where we'll kind of go over everything. And if there are any questions that aren't answered during that time, during the time of each section, we can ask them at the end, and that way we can try and keep this meeting moving and get a lot of you guys, it looks like, back to work today as well too. So, and the rest of us. So, old business revenue loss report related to Digitech.
Thank you, Mr. Chairman. Just to reiterate what you said, there is a lot of information, but I'm happy that I believe a lot of it is good information today. So we look forward to sharing it. A follow-up to the request from the last meeting, this committee requested a report that would outline the loss that we incurred when we changed billing companies. So if you remember, we changed billing companies back in August, September-ish of 23, last fall. And because of that, there was some loss that was associated with it. I don't have a specific report to share with you. I know this is something that Mike also worked on before he left, and I've looked into as well. Frankly, it's just really too difficult and time-consuming to get to an accurate number, and I know that that's not satisfactory. I'd like to know what this number is too, but it's also important that if we're discussing a number that we know it's accurate. The best that we can come up with, and again, this is still not accurate, is a little over $100,000. Okay, why is it not accurate? Well, because there's several reasons why a call may not have gotten billed or been able to be paid. Some of that could potentially be our fault, right? We know in the past that we've had issues with timely billing, right? If something is not billed from us in a timely fashion, it depends on the insurance company, but oftentimes if it's too long, if it's beyond 90 days, 100 days, 120 days, that sort of thing, it just doesn't get paid. And so what we really can't determine, and that's just one example of the many factors that could cause something to not be billed. As we've also talked with Crystal, or as I have talked to Crystal in working on this, even if we were to come up with a number, and let's say that number of 100,000 is accurate, you know, what are we going to do about it, right? You know, are we going to sue this company? So, I mean, that's obviously not a question that we're here to answer today. But unfortunately, I don't have a real accurate number to share with you. So, any questions on that piece?
Commissioner Blake?
Well, I mean, are we making a decision that we're not going to go after this, or are you just informing us that those are that's the battlefield. I mean,
That wouldn't be my decision, but I think if we were going to even entertain that, we would need to have firm information, and that's what's going to be difficult to come up with. I just don't think that we're ever really going to be able to get to a number that we could accurately state is a loss. My opinion, if you're asking me, we'll talk about this later in the collections report. We are way up,
all right.
and my thought would be let's focus our effort and energy moving forward. Lesson learned, and let's look at moving forward past this.
So, Mayor, you're water under the bridge kind of thing. I mean,
Well, I agree with the latter comment there. If you look at the report, and it sort of happened the last time, there's a loss, you might say, there's a down collection time, in this case for 2 months, but then it jumps up to more than it was before. So you can look at that and conclude that most of it has probably been collected. Getting down to exactly what wasn't and whose fault would be hard to prove if you were looking at going the other route. So at the end of the day, we've collected what we thought we were and then some. But we can't say there wasn't some loss. But the 2 months is the period. And then you come back the third month after these new people took over, and it jumped way up. So that makes me feel like that we got most of it back, and what's not there, whether it's 100 or 50, would be tough to push and prove.
Any other questions at this time? We'll move to old business item B, hospital pre-authorization report.
So this is a simple number to report. May 1st, we stopped taking these calls. Really felt like, and I'd been involved in some of these discussions, both internal as well as at the hospital for really the last year and a half. And the fix was always pretty simple to me, and that was we just simply don't take the call if they don't do their job. We gave the hospital over a year to address the issue, and they made some progress, but it was never something that was taken care of at 100%. And so effective May 1st, we no longer transport calls from Tenova to another facility, namely another hospital, if it requires a pre-authorization. Okay, not every transport requires a pre-authorization. You're really only talking about Medicaid, and so it's a small number of the calls that we take, but it was the number that we, as we looked at it, we were, I think at one point we were averaging close to $25,000 a month that we were not being able to recoup, or essentially we lost because we were transporting these folks and didn't have the proper prior authorization. So effective May 1st, we no longer do that. So the answer to the question, or the number to report, is 0, and that'll be the case moving forward.
Any questions for old business item B? We will go ahead and move on to our normal agenda items. First is item A, equipment upgrades.
So when I started over there April 1st, I met with the commanders, the 4 commanders, on the first day, and one of the things we discussed and I asked of them was a wish list of equipment. And I asked them to give it to me in order of priority, and we've been making really good progress on that list since then. Some of the items that I'm going to mention to you here in just a minute are items we already have ordered, have already received, and have already put into service. Some of them will have been ordered and will be received within the next month or so. But we have a Lucas device was one of the things that was at the top of the list. We actually have had, or have, 2 of these devices. The Lucas device is a device that's used during CPR. It's a automatic machine that does the chest compressions for you, right? And if you've ever seen a CPR call, it is impressive to watch a human being do it. And you can imagine, especially for some of these calls that may last 30, 45 minutes, up to an hour, I've observed, that's a lot to ask of one person to do if you're doing it properly. And so these Lucas devices are invaluable. They're terribly expensive. They start at around $20,000 a piece, brand new. We've had 2. One of them was broken. The other had a piece that was cracked. And so we have taken steps to repair the one that could be repaired. We have one in service, and I recently submitted a grant a couple of weeks ago to the state that if awarded, we will be able to put one of these devices on every one of the trucks that we have in service. It's a grant for 8 Lucas devices, and so we will hopefully hear back sometime in July on whether or not we were awarded those funds. But we do have one in service that's been repaired and refurbished and is in good shape to be able to use. The other item that has been a need for quite some time is a transport ventilator. We would often get calls, typically from the hospital, where we would need to transport someone from the hospital to another hospital, and the person was on a ventilator. And we did not have the equipment, and haven't had the equipment for some time, to be able to take those calls. So we either had to defer to someone else, they had to fly them in some cases, because Life Force has that capability, or we would have to borrow their equipment. And as the mayor can attest, it's been a complaint that he's received from doctors at the hospital. It's sort of been a thorn in their side when we have to borrow. So I'm proud to be able to announce that in the last month we've been able to purchase a Hamilton T1, which is considered top of the line. It's the same type of equipment that the hospital uses. Most of the hospitals, Life Force, it is the standard. And so we've been able to secure one of those, and are anxious to be able to put that in service. We've been waiting to get the rest of the equipment that goes along with it. Not the equipment, but they're called circuits, all of the tubes, if you will. It's a company-specific item, so we've had to go through the process of setting up a new vendor and that sort of thing. So our folks recently trained on that piece of equipment as well, and so we're anxious to implement that into service. Other items, slide boards. These are items. A slide board is now on every truck. It was one of the items that was on the wish list. It makes it easy to move people from stretcher to stretcher. It's just a simple thin piece of plastic with handles that really saves a lot of backache and a lot of manpower. As we look forward, and some of this you will see if you dig into the mayor's proposal on the EMS budget, but we are anxious to be able to buy some new equipment when it comes to our training program. We've not had that in the past, and so a lot of our equipment is very outdated, and so being able to update the training equipment is something that we're looking forward to as well. Ordered this week, we have thermometers that will be wall mounted in each of the ambulances. If you can imagine, what most of our trucks are using are these little trigger thermometers, which are horribly inaccurate. I don't even use them on my kids because I know they're that bad. And so these are, again, state-of-the-art wall-mounted thermometers that will be in each of our trucks once they come in. And so those have been ordered as well. A few other things, we are in the process of adding a gasoline tank behind the main station. The tanks that we have there, if you're familiar with behind the station, are diesel tanks, and so it's going to be a big help to have a gas tank back there. So we're anxious to have that. Wait on the contractors to pour concrete, but then after that we expect to have a 1,000-gallon tank placed behind main station on Paul Huff. I think you may have seen this too if you looked at the budget request or the budget proposal. We are upgrading a trailer that has been dilapidated and really hasn't moved in I don't know how long, behind the main station. We've several years ago had a donated golf cart from Hamilton County EMS that we've really only been able to use a handful of times because we don't have a way to transport it. So it stays at Dooley Street, and I think it's been driven down to the parade down Inman Street a couple of times. But if we're really going to utilize that piece of equipment, which we can, we need a way to transport it. And so we are redoing the trailer to be able to transport that vehicle for events. We've got 7 new computers that are going to be going in at both stations over the next couple of weeks as well. There were a handful of trucks that did not have trauma bags that we've been able to secure all of the necessary supplies and the additional bags to make sure that all of our trucks have a trauma bag on them as well. We that primarily is most of what was on the wish list. The only thing that we haven't really been able to tackle, and I hope to be able to soon, would be new furniture. For if you've been over there and you've seen the furniture that's there, it could use an upgrade, and so we're looking at possibly trying to either find donations for that or at least a deeply discounted deal somewhere locally. And a lot of this has been done obviously within our budget, but some of it has been done and some of it will be done through donations, and so as well as grants. And so we're looking forward to moving forward. Last but not least, I think one of the biggest things was light bulbs in the kitchen. We didn't have light bulbs in the kitchen, and we got those. This is more of a joke than anything, but it was a little thing that we could find and take care of pretty easily. So that's the extent of most of our equipment upgrades that have already taken place or are about to.
The ambulance, what's the latest on the one that's?
So I can jump down to that when we talk about fleet. We are about a month away from having 12 total vehicles. The ambulance that the mayor's asking about is a Ford re-chassis that's over in Middle Tennessee right now that we got word on as late as this morning is about 3 to 6 weeks out from being complete. When that truck is available to us to put in service, it will become 502, and our plan is to take that out to Minnis Road, where the 510 will then become a backup for us. So on a good day, I mean, to give you a point of reference, on a good day or a good shift, 8 trucks in service, okay? So the fact that we've got 12, and 2 of those are the ambulances, the convalescent vans. Well, when I tell you 12, it's really 10 ambulances and 2 convalescent vans. We have some backups, and there'll be some discussion about a couple of those, whether or not we will continue to keep those as backups or look at possibly selling them and reinvesting the funds to cycle something new.
Are there any questions on equipment upgrades?
Yeah.
Commissioner Lefford?
Yeah, hey, just a note, FYI, HCI, I was on that committee for 13, 14 years. We done even when Danny Lawson was there, we done several pieces of equipment through the HCI. So I know you won't, don't forget about the HCI. And number 2, great job, Adam. Thank you.
Any other questions? Commissioner Blake?
Those devices that you said they're 20,000 a piece, and you need 8 of them.
Yes.
So 160. So if you get the grant, great. If not, like you said, HCI. But is there maintenance with those as well? Usually those kind of things, the vendor wants a yearly or some kind of maintenance thing, so you would have to budget for that. But obviously, it's well worth it.
There is, and it is expensive. To give you a reference, so the one that we were able to, so the 2 we have, one was too old and couldn't be repaired, so it's a glorified paperweight. The other one that was able to be fixed, we had 2 options. We could repair it and pay to have it repaired for $1,700, or we could pay $1,600 for 1 year for the maintenance agreement. And then with that, we would get the repair as well as refurbishment and new batteries. So it was a no-brainer, but you're still talking about $1,600 a year per device if we wanted to maintain that type of maintenance agreement on them, which would be ideal. Obviously, we've gone without it for however long because it hasn't been something we paid for, but in a perfect world, you have one in place annually for each of the devices that we would have.
Yeah, I was just saying, I mean, with these grants, they purchase things and then the maintenance on you to budget
That's right.
annually, and you just have to budget for it, but it's well worth it.
Commissioner Collins?
Thank you, Mr. Chairman. This is not my world or field of expertise at all, so I appreciate you sharing all this. I would love to hear your perspective about with the equipment upgrades that are likely necessary. Do you see it as necessary, or do you have a vision for a 1-year plan, a 3-year plan, a 5-year plan in terms of upgrades and just, hey, this is where we want to be year after year. This is where we want to be 5 years from now. Is that something that you have a vision for?
I think when you look at the equipment, like I want to answer your question, but I want to separate equipment
Sure.
from vehicles. I think when we're talking about the equipment, we still got a ways to go to get everything that we want and need, right? I think we've made good progress, but there's still some devices that we would want and need. Beyond what I've listed, I really think you almost get to the point where now you start making a Christmas list of stuff. I mean, there's some really cool equipment out there that would put us way ahead of other agencies, but it's not probably a need as much as it would be a want. So as far as the equipment, I think it's important that, especially anything new, that we do our best to take care of it, number one, but that we keep any sort of maintenance agreements in place. And the plan would be then to just replace as necessary. Some of it has a shelf life, some of it doesn't. When it breaks, right? Luckily, most of the equipment that I mentioned doesn't have a big price tag, but several of the more important pieces do. So, I think it would be ideal too to have another transport ventilator, which is anywhere from $12,000 to $15,000. So, one is great, two would be even better. As far as the vehicles, and this is again something that I was going to mention down in Fleet, so this really we can wrap up Fleet, I guess, after this, is it's not indicated in this budget, but in my conversations with the mayor, there is a plan to take a look at. We've done a lot, mainly with ARP funds, over the last couple of years with new trucks. And so, we talk about the breakdown between Fords and Chevys and Internationals. I think the general thought is that one day we'd like to be rid of all of the Internationals. We're nowhere close to being able to do that. But in conversations with the mayor, as we've looked ahead to next year's budget, there is already discussion about what are we going to do next in terms of vehicles. And so looking at, there's nothing in this year's budget, right? But yes, we have already begun to look at, what does that look like, and how do we cycle through and replace as needed so that we don't get hit all at once with a bunch of old vehicles.
How many Internationals do you guys currently have?
1, 2, 3, 4, 5 Internationals.
And we've gotten rid of 2, probably.
Yes.
And concluding on the fleet, so you can check that one off. The number one priority in this year's request was for the supervisor vehicle. Is that how you refer to it?
Command staff vehicle, yes.
Sir?
Commander
vehicle.
Staff vehicle, yes.
The one they had was dying or dead, so during the interim, we took the director's vehicle and gave it to them to use. And now, is that the one that's died, or is it still going?
No, it's still going.
The former director's just recently died. We call it the Danny Lawson truck. So the former director's truck died. The current one was dying, and now they're using the director. So that's in the budget to replace, hopefully brand new if the price works out. Something he didn't know about. And then for 25, not immediately, but because they're a year out in ordering, there is another ambulance in the ARP budget when you're looking through it for next year. It's not something I want to spend today or tomorrow because of the interest issues that are starting to be, but we can get it on order because they are still roughly a year out, even with the re-chassis one. This one's been months. So there is money for next year in ambulance. There's money immediately for the supervisor vehicle, which is very much needed.
When we're talking about non-ambulances, you have the director's vehicle, which is a big white truck, which is being used right now by the lieutenant. So in terms of command staff on any given shift, you have a commander who drives the Durango that was purchased last year. And then what we are going to offer the lieutenants, because you have a commander primarily stationed at the main station, and then a lieutenant who is primarily stationed at Dooley Street. And they are in quick response vehicles. They oftentimes can get to the scene or go to scenes when we don't need a full-blown ambulance to respond. We would send one of them, okay? Right now, we only really have 2 vehicles. We have the Durango that the commander drives, and right now, what Mike was driving, which is the 250? Ford F-250, which is great. We want to keep it, certainly for the director, but we'd really like to keep it just to help run supplies and equipment because it's got a lot of space in the back. So with the new Durango in this year's budget, that will go to the lieutenant. So you'll have a commander and lieutenant on each shift, both in quick response Durangos. We do have 2 vehicles, one that we're in the process of getting rid of through either disposal and sale, or maybe even transfer to a different department, and would have been the truck that Danny Lawson drove. It doesn't even run, so it's been stripped of everything we can use, and it's sitting over there next to Dooley Street. The only other vehicle that we have is I don't even know how old it is, but it's a Ford Explorer that is really on its last leg. Wouldn't even be worth it to probably fix up and repair. It runs. We use it primarily to move supplies back and forth between the 2 stations.
Seeing any other questions, you can go ahead and mark A and F off of your agenda there, and then we'll go to B and start on staffing.
We've been able to hire 5 new employees since April 1st. Not all of those have been full-time. I believe only 2 were actually full-time, 1 full-time. That leaves us with 1 full-time paramedic vacancy left. I mentioned in the Finance Committee meeting that we really over the last year, I think it was Finance, Mr. Alford asked a question and I answered. We've been around 4 to 6 vacancies over the last year, and so that's down to 1 full-time paramedic vacancy. That number will change. You know, I know right now today we have a few folks that are leaving us, unfortunately, over the next couple of months, all for legitimate reasons. It's not because they're unhappy or they can go make money somewhere else. One is leaving the industry to go become an engineer. One is leaving to go to medical school. But those are 2 full-time positions that will open up just within the next couple of months. And so we'll always have movement. We have hired, as I said, 2 full-time employees, and 3 of those 5 were part-time. It's important to note when we're talking about vacancies, that number 1 is what we are budgeted for, not what we wish we could have to fill all of our 12 trucks, right? So several years ago, those vacancies that we had, 14 or 15 of them, I think, were cut back to be able to provide higher starting salaries and raises to the employees that were there. And my hope would be that if we're sitting here in a year or a year from now, or even 9 or 10 months from now, and we only got 1 vacancy, that we begin to have the conversation about how to pepper and add those positions that were cut back into the budget, right? But there's really no sense in talking about that until we've demonstrated that we can hire and stay full on a consistent basis.
Commissioner Alford.
Yes, how does our salaries now compare with the region area around? Are we getting closer to other people around?
We've not done I think it's been a couple of years since we've done a real study to look. The short answer is no. We are still we are still below the Hamilton County. I know, for instance, you could probably look it up on Facebook right now. They advertise what their starting pay for a paramedic is, and it's several dollars more. When we compare to the private services, we've not looked at it recently. One thing that we will be doing that I don't necessarily think has been done or hasn't been done consistently in the past, the mayor's proposal has a 3% raise for all county employees. And I believe in the past, even last year, the starting salaries at EMS were not raised by that 3%. So last year when everybody got a 3% raise, the starting salary stayed the same, right? They were raised, okay.
That was the first year, I believe.
Yeah. So there have been years where that hasn't been the case. This year we will. We'll take the starting salary for a paramedic, which is $20.99, and raise it by 3%. So that's important, but it's still, to answer your question, no, we're still not competitive in comparison to some of the other services around us, private or public.
When you say we're not competitive, we're not close, or are we? in the ballpark, or have we done any kind of study to see if we could upgrade or whatever?
I have not done a study to know for certain where we stand in comparison. Let me see if I can look up real quickly, or if somebody knows off the top of their head where. Yeah. So we're paying our medics what they start AEMTs at.
Well, I would think it would look at communities similar to ours.
Right.
Hamilton County, you can't judge what they do
Yeah.
because they're so much larger, but, you know, places like Greenville, towns that are comparable to
Yeah.
ours, or counties.
Yeah.
I think that's where you would start and see what we're averaging. When you look at Hamilton County, I don't think we're gonna get a good comparison there. So I
It
think
would
it'd be
certainly.
important to look at communities that are our size.
I agree with you completely, and I think that means not necessarily looking at what the private services offer either. If you're looking at for an apples to apples comparison, our employees or employees that might be interested in working for us aren't necessarily looking at apples to apples. They're looking at who's going to pay me more. So while I agree with you, it's helpful to compare apples to apples in terms of similar communities and sizes and even call volume. That doesn't necessarily translate to an employee who may or may not want to come work for us because they're just looking at what that bottom dollar is. I've only been there 2 months. If I'm still around long enough, it is something I'd like to look at. I know at one point, Mayor's going to not like me bringing this up, that that there were step raises at EMS. Some of you may remember. I'm not here to propose or suggest anything, but I think if it's the will of the commission to look at that seriously, I think that there's ways we can go about getting the right information to be able to make an informed decision moving forward.
If I could add on the salaries to refresh your memory, we did the study, a somewhat study, 3 or 4 years ago, 2 or 3 years ago, whatever it was. And at that time, we addressed it by freezing. We were the first one to do this. We froze positions, put more money into salaries, which helped a lot. Since then, as you know, the sheriff agreed to do that. The sheriff is already starting to replace frozen positions. One's in this budget. Next year, we probably, hopefully, their numbers will stay full, and they'll be requesting to replace frozen ones. And we need to do that as we can afford to do it. The sheriff asked for 3 this year. He's getting 1, but he deserves to get that 1. He froze them. Now he's back to full, or he was at that time. I assume he still is. Same thing here. So we'll be looking at replacing the frozen positions gradually over time as we can afford it. Being on the realist side of the issue, since there's a lot of employees here, the difference is I don't talk as hypothetical as some. I look at what we have to pay, and the 3% raise for everyone was all we could do this year. We could have done 0 and 5 maybe, but I'm never going to single out one department to get more than everybody else because they're all equally important in various reasons, in various ways. But the freezing thing has worked really good, I think. I'm not sure what they would say on it because those positions weren't there anyway, and it did free up money that we turned around, and I don't remember what the immediate raise was, but 1,000 or whatever it was, but it was a decent raise at that time, and some of them seemed to appreciate it. Probably the ongoing issue that we have to look at, and we have to look at this countywide too. We can't single out one department, but most of them will tell you when they leave, if it's for a reason other than to become a doctor or an engineer, it's because of cost of family health care. But the cost of family health care countywide is a tremendous, tremendous number. That is a true issue that they have, and we know that. But again, I can't just create the dollars to pay for it. So it's an ongoing challenge out there, is getting the cost of family. We offered another option which lowered the cost of family, but they'll say, well, and you get the cost of family to match the cities, then I'm okay. Well, that's a big chunk of money to do that countywide. So that's ongoing challenges that we have both in salaries and benefits. Our benefits are good. It's the cost of family that is the legitimate complaint they have, they and everybody, whether it be sheriff or ambulance or fire or whatever. So we know that, but having the dollars to fix it is the issue.
Thank you, Mayor. I would say this too, and I know Commissioner Blake and Commissioner Collins too. I think every business and every job and every person who pays a salary to someone in this day and time with the cost of inflation and everything else that's going on in the world, like that's a struggle across the board and the entire United States. And so I think that you guys have done a lot, I want to say too, I think to try and combat that, freezing jobs and giving those raises over the years, right? Like, and then I think also, you know, your medical protocols and what you guys have there, I think is outstanding and way above everyone else. And so I think there's a lot of people in your department that see that and see value also being in Bradley County. And so I definitely, something that I will say and will ask of you, Interim Director Lewis, is can we do a starting pay study and bring that back to this committee to look at and review? You know, I think that it's important for us to stay relevant, stay accurate, and then also be able to provide that information to the mayor and his team to be able to look at going forward. Commissioner Blake.
Mr. Chairman, Adam, real quick, one, the revenue projection went back up to 5 million. So years ago, we never met it, so we had to go down to 4.5 million. So the revenue projection now is back up to 5 million. Good. Obviously, expecting higher than that. Adam, so the overtime, you have overtime at 19,000, and you have overtime part of salary because of the scheduling requires
Built-in overtime.
so for a total of 779,000. Aren't you getting close to where you can basically cut some of the paying time and a half and some of that time is like full time? There's always that balance. The industry standard is usually about 50% of what you're spending on overtime. You can use that way and hire full-time people and eliminate the need for overtime. So, it's an analysis that we do quite often, but with 779,000, pull that over into one of your salaries like 105 or something like that, you would reduce your overtime if you have a full-time person.
Adam, let me jump in on that first. And he's exactly right. When you get to a point, it's cheaper to hire full-time as opposed to keep paying overtime. But don't use that second line. It's confusing. It's called overtime, but if a guy makes $50,000, part of it's paid out of regular, part of it's paid out of that quote built-in overtime. So that's his salary. If you add a full-time to it, that's going to increase that line also. It's not going to decrease it. Now, it should decrease the true overtime line. I don't have the numbers in front of me, but don't add them together. When we do the analysis, just look at the true overtime line, because the law dictates us to pay them out of 2 lines. It says we got to pay them out of a salary line and a built-in overtime line because of the hours, the 12-hour shifts, and firemen same way with their 24-hour shifts. But if you add those two together, that would be incorrect, because just think of that other line as part of their salary. The $300 and something thousand overtime line is a true overtime, not 700 and something thousand. If you, again, what I said was, if you add a full-time person, he's going to be paid out of that other built-in overtime line. You follow me, Adam? He's going to be paid out of 2 lines. If you have 10 or 50 full-time people, they're going to be paid out of those 2 lines. Both of those lines are going to have to go up. But the true overtime line is the one that dictates, hey, our overtime's getting so high we need to replace, which we're going to be doing anyway by unfreezing positions. Our challenge next year, I promise you, will be how many positions can we unfreeze for ambulance and for sheriff? Ambulance has had them frozen for 2 years longer than sheriff, and sheriff's already requesting them. So we're gonna have to start replacing those frozen positions. That's our agreement. Freeze them. When you get full, we'll replace them gradually as we can afford to. So that's gonna eat up next year's budget request almost day one. Unfrozen sheriff and unfrozen ambulance, if they stay fully staffed, and I hope they do, fully staffed at today's numbers. But again, back to the overtime, yeah, the only thing I picked up that you were saying wrong in your analysis is just don't use that second line, because just think of that as two salary lines. We divide it to please the federal government. It's the only reason there's two lines.
I understand that you had to do the itemization piece of it, but it's still overtime. That's time and a half. It's part of their schedule, so their scheduling, I mean, they still get the same amount.
But as long as we work 12 or 24-hour shifts,
I would think that it would still be part of the analysis, so that if there's a possibility, because you used to not have that, then you went to it.
when we went to 12 or 24-hour shifts, we had to.
Right, so the scheduling should be part of the conversation to reduce 400.
But now you're indicating to go back to 8-hour shifts, which takes even more people. I mean, this gets very complicated, but we're not. Let's go back to, I'll use the fire as an example. When we started the fire department, we said we're going to pay you $30,000. That $30,000 isn't really overtime, but 20 of it may show in the regular line and 10 of it show in this quote built-in overtime line. They're still getting the same $30,000, and you're not going to lower it unless you cut their pay. And the same thing with these guys. Theirs is different because it's not 24-hour shifts, but I see some blank looks out there too. I promise you, the salary has to be divided into two, and unless you went to 8-hour shifts, you're not going to eliminate that second, quote, built-in overtime. And if you do eliminate 12-hour shifts, then you're going to have even more vacancies to fill, which until you do, it's going to be more overtime. The way it is now works, and as long as you stay with that single-hour thing, you're okay. I don't think it's going to be recommended or proposed that we go to 8-hour shifts straight out, because there's just not enough medics out there to do it. Some of them might want to, some of them probably don't want to, but there's not enough out there, and to go to a straight 8-hour shift like we used to be, in my opinion, is probably not ever going to happen this day and time, because they don't exist. The bodies don't exist. But anyway, enough said on that. I didn't mean to go into it too much, but I know with all these employees sitting here, they're not, if they work their normal shifts, they're not getting paid overtime. Now, federal government's perspective, they are, because they worked more than that required, that total number of hours. So part of it has to be shown as overtime. That's your built-in overtime. You only get true overtime if you work more than that shift, the hours per week. I may not have said it right, but the finance person's sitting over here, but I'm right in theory in what I'm saying here. So I don't want the employees to get confused. We're trying to cut your overtime. We would love to cut you where you don't get any true overtime, and if we were totally fully staffed, you wouldn't. That would save this figure he's talking about, that 307,000. Most of that figure should be from, and I'm going even farther, but it's shift change. You guys are on a call, it's 8 o'clock, you don't just go off the clock. You might work another hour, taking that person who was about to die to the hospital and seeing him get off the stretcher onto a hospital bed. So you got an hour of true overtime there. That's going to always happen, right? And vice versa. So there's always going to be some overtime, but the overtime line would go down. The true overtime line would go down as we fill more full-time positions. But both of those other lines are going to go up, both of them. The one that says built-in overtime is also going to go up as we fill those full-time positions. So I'll hush with that. I hope I haven't complicated it, but it is a complicated thing, trying to satisfy federal government as well as doing what we do. We had to go back. We didn't know that law applied to firemen, so we had a one-line salary, and we had to go back. They came to us, said, federal government requires you to pay them overtime. I said, I'm paying them $30,000. They're not working overtime. According to the federal government, you are working overtime, so that's why we had to divide it into two lines. It's always been that way with that, or it's been that way for a long time with ambulance, but that's when we had to create the second line for fire, is so that federal government could see that over those number of hours, part of it's regular, part of it's overtime, even though you're just working your normal regular shift. So trying to please them and keep employees happy and also meet the budget is a moving puzzle sometimes.
Thank you. We'll move on to number C, collections report, and you can go to page. All right.
Mayor, when do we have a date set to choose a director for EMS?
No, there's no drop dead date. Think of it this way. I'll keep pushing him, and in the meantime, we're saving lots of money because we're not paying two salaries, and we've got the truck on loan to them while we're in this need of a vehicle till we get one bought. And I think it would be safe to say that everyone's fairly happy at the department. So there's no need to rush, but no, there's no timeline. If somebody came to me tomorrow that was qualified to do the job, was willing to start at the pay and the budget, I would definitely consider it. Don't get me wrong. I'm not have a closed door to it, but also I'm not saying there's a drop dead date out there.
I just want to say this, the appreciation for Adam, this guy's doing the assistant to you and director and doing a wonderful, great job. I know it firsthand. I work there. I see these guys. I talk to them every day. And so I don't know. I wish we could do something for him because of the extra. This guy is going in the evenings and visiting these people. And I know I praised him the other day, and I can't help it. I'm sorry. But when you get somebody that puts this much effort into bending over backwards to make these guys happy, every single EMT paramedic that I've talked to is happy to be there. And that didn't used to be that way. Every time I would walk through the ER, it was, oh my gosh, I'm hoping somebody calls me. I'm wanting to get out of here. Polk County, wanting to get out, but I don't hear that anymore. So there it is again.
I agree, and that's a good thing. Don't blow his head up too much, though. But we do appreciate what seems to be happening out there, and I think they do too. What'd you say?
Do you have two more things on staffing?
But anyway, we appreciate what Adam's doing, and it's not helped me a whole lot because my guy's on loan. But anyway, it's working out good, and I think it's working good for the department. I really do.
Just two more quick things, but I appreciate the personal kudos, but it really is a team effort. We talked early on, and this ties into staffing. Do we need to pay more to be competitive? Absolutely. But I think if you drive down the road to Hamilton County and ask them how many vacancies they have, they're having a hard time filling those at $25 an hour. That's not an excuse for us to ignore the fact that we're $3-4 behind, right? But all that to say, I think you can look at many industries, law enforcement included. You can look at the hospital that struggles to fill vacancies. Money helps, but it doesn't always solve the problem. And so what I've talked with the command staff early on, and we continue to talk about on a daily basis, when it comes to staffing, whether it's recruiting or retaining people, there's some things that are just outside of our control. And we are choosing as a team to focus on what we can control. We can't control what the starting pay is. We can't control what the cost of family insurance is. And as the mayor alluded to, that one piece is a significant barrier for us and us as a county. 2 years ago, when we studied what it would cost to make family insurance affordable and comparable to what the city pays or what a city employee pays, it was anywhere from it was $800,000 a year. And despite what people think, the mayor doesn't have a piggy bank in his bottom right desk drawer with that kind of money sitting in it. So where do you come up with that kind of money to fix a problem that we all know exists? So what we've talked about is the fact we can't control those two things, but what we can control is whether or not we've got the right equipment, whether or not we've got good working equipment, how well we're training, how well we're preparing for the day and for the shift. We can control our attitude. Morale was a horrible issue over there. I said day one, you fix the morale in this place, and I believe this would be the case anywhere. You fix the morale, and that's 75% of the problem. right? If you're miserable at a location, it doesn't matter how good the equipment is, how much you're even paid oftentimes, you're still not happy. And so when I say it's a team effort, I can say that as the interim director, but it's these folks that have to come in every day and make the choice. I'm going to come in with the right attitude. I'm going to come in and support my coworkers. I'm going to come in and respect the folks that are trying to support me and lead me. And so while I appreciate the personal kudos, it very much is a team effort, and we wouldn't be sitting here talking about nearly any of this if it wasn't for the fact that the folks behind me have been a big part of it as well. Two quick things on staffing. The mayor really only told me one thing before he sent me on my way to EMS. He said, find me more paramedics. And I think we've all talked about the fact that we need more paramedics, we want more paramedics. And frankly, they're not knocking down our door to come apply. We were fortunate to hire one full-time paramedic recently. We've got a number that are part-time, right? When I've dug into, not to beat a dead horse, but when I've dug into, well, why are you a full-time paramedic working somewhere else? And the answer is almost always because I can get affordable family insurance somewhere else. They're working somewhere else full-time to get the insurance and still work for us. In many cases, I've asked them, 8 specifically that I asked, that were in that boat, how many of you would come work for us full-time if the family coverage was more affordable? And 7 of 8 said that they'd be here in a heartbeat. So again, not to beat a dead horse, paramedics aren't applying, but I'm proud to say that there are 8 advanced EMTs that are in school now and will graduate with their paramedics license in the fall. And so what we've also focused on, if we can't recruit them, then let's at least do the best we can to grow and retain them. And so we will have 8 new ones if they so choose to stay, and I hope that they do in the fall once they get their medics license. We've also brought EMRs back. EMR is an emergency medical responder, and they are primarily at our fire department. You might remember in the past that those were folks, they really can only come drive for us, which may not sound like a whole lot, but if you're short-staffed and only have 6 trucks and you can put another truck on the road and all you need is a driver, it's a huge help. And so we've had a handful of folks from over at Bradley County Fire that have come back and are serving with us in a part-time capacity. They love it because they get their time and a half, which is way less than what our folks are making, but it's great money for them, and it certainly helps us out. So we're thankful to have those folks back as well.
Can I ask one follow-up question, and we're going to move on to collections report? Those 7 of 8 that you said, that you talked with 8 people about coming to work with us full-time that were part-time people, were those people who were currently paramedics?
Yes, that's what I meant. The 8 people who were part-time for us that are paramedics.
7 of them said that if we
Yes.
fixed family insurance,
Yes.
they'd come work
Yeah.
for us full-time?
But again, that sounds like an easy fix, but when
Sure.
we studied it 2 years ago, it was $800,000 a year.
Yeah.
And that was only an estimate because we weren't really sure how many people would actually take us up on signing up for that coverage. So, you know, I think money doesn't solve all the problems. It would certainly help. And it's certainly not an excuse. The fact that other folks are having the same problems we are that are paid more isn't an excuse to not address it. But I'm also proud of the fact too that we've got folks that frankly could be working anywhere else right now. I think of one of our sergeants who lives in East Ridge, and I remember on night shift when he made the comment, I drive from East Ridge, and I stopped and I literally asked him, why do you not work for Hamilton County? And he said, because I love Bradley County EMS. I love our protocols. That's something, if you haven't heard that and don't understand that, our medical protocols, what they are allowed to do, how they're allowed to treat a patient, are much more advanced, much more invasive is the right term. They're allowed to do more cool stuff, right? And that's attractive if you're a paramedic or an EMT. He mentioned that, you know, our protocols, the people, the call volume in some cases. I've talked to folks at Hamilton County that hate working for Hamilton County because they hate the call volume, or they hate this, or they hate that. And that's why I go back to, it's more than just what you get paid. It's got to be those other X factors that are a part of or should be a part of any organization. One quick thing too that falls into staffing, and I'm sorry to keep dragging this on, but I want to give a quick update on the mental health program. that's something that we started really in this current budget last July, where we fund, and this is not just for EMS, this is for any first responder, including dispatch. Dispatch, yeah. The county essentially pays for mental health treatments. So if they need to go see a counselor for whatever reason, we've not said it has to be work related. Frankly, it's anonymous, and we stay out of it. I get a bill once a month from the providers that we have partnered with, and I can tell you that dozens and dozens and dozens of our folks have been participating in this, and I don't think we will ever know just how much that means. That is a benefit that I'm not aware of anywhere else, and so that's something that this commission and I think Bradley County can hang their hat on. That's being paid for by the opioid funds that have come in. It was one of the allowable expenses, and I hope that that's a part of our budget for many, many, many years to come.
And if I may, we're going to continue that program for as long as we possibly can.
Yeah.
I mean, we got 17 years of opioid money. I don't think we use it all, but as long as we can, we're going to put that in there.
We'll move on to collections report, which I think is another great thing.
Yes, so Monday I took a check to Trustee Smith's office for $473,454. Get down to I can get the cents for you, Mr. Blake, if you need them.
15 cents.
Yeah. Which brings our fiscal year total to a little over $5.3 million, which is tremendous. As the mayor mentioned earlier, EMS has struggled for a long time to hit their budget projections. And for a point of reference, the budget projection for this year was $4.5 million. So with a month left at 5.3, we're poised to be over $1 million over what was budgeted as our revenue projection. While that's a great number, EMS, to my knowledge, has never been and probably never will be self-sufficient, right? When you're dealing with a little over a $7 million budget, we've made progress, but you're talking about an additional $2 million in revenue just to meet this year's expenses. So I don't think it's a goal or we should never look to be self-sufficient, but it certainly helps. I know it helps the mayor and helps the general fund to have brought in an extra $1 million, and I think that's a trend that we hope will continue. A lot of that is due to the change in the billing company, and a lot of it is also due in part to the great work that the girls do in the office. The ladies in the office are extremely busy. I know that there have been questions before about, well, how, what is it that they do? They are a big part of why that number is as high as it is today too. And so in the past, there have been reports of how far behind, or back to the timely billing issue, we've been as many as 90 days behind in billing, or when we send information to the billing company to be billed. And that's dangerously close to what we talked about earlier, where we are in jeopardy of not even getting paid because of how many days it's been. But I'm also proud to report today that number is down to just 45 days. Our target is 30, and I think that's going to be very attainable in the next few months.
Do you guys project out month to month, or is it just kind of wait? I'm just curious, we still have June left. Do you have any type of projections of what June might bring?
I mean, if you look at the average, Lori gets a report at the beginning of the month. I assume she sends that out to you all. But if you look at this year, I mean, your average, we average around 400,000. So I think 450 would be a good target for the last month.
So we'd be looking at probably somewhere around 1.3, 1.4 million additional revenue.
That's correct.
Than projected or budgeted.
That's correct.
Any questions on revenue collections report? Commissioner Alford.
The average cost, is that comparable on a run to other areas too? Or are we still way under what we charge compared to other places? Do we still do the convalescent? Do we still run the freebies there?
Do we run freebies?
Yeah, on the convalescent.
Yes, in some cases we do. Most of the rates that we charge are are set by, I mean, it's based on insurance rates. So I don't know that we've ever done, to answer your question, no, I've not done a study to look at what we charge compared to others. Largely, it's going to be set by insurance, and so the rates will be the same. Really, when you get it, there are a handful of calls, and boy, we can get in the weeds on this. You know, there's long been the discussion that Bradley County EMS either needs to be run like a business or run as a service to the community, right? I believe that we've just got to strike a balance. If we were to run it like a business, there's a lot of things we would need to change today, because there are things that we're doing that just frankly are losing us money, that don't make good business sense. But if you look at it through the lens of offering it as a service to the community, it does make sense. But there are, and I maybe can jump down to this section E. You talk about the convalescent calls, or code 80s as they're sometimes called. We recently also stopped taking certain calls that fall into that category. Doctor's office visits, where we would get a call through dispatch, or it would be scheduled ahead of time through the office, and we would go to one of the facilities in town and pick up one of their patients and take them to a doctor's office visit. We stopped the calls because, frankly, it was costing us several reasons. It was costing us a large amount of time. I don't know if you've been to the doctor lately, but you don't usually get in and out. And so we would have an ambulance sitting there waiting for sometimes several hours while a patient was in waiting to see a doctor. This might be a testing location. This might be a doctor's office. This might be a specialist's office. My favorite is when the patient was new, and we show up with a new patient, and guess who gets to fill out this mountain of new patient paperwork? One of our employees. An amazing service to the community, but when we're spending hours at a doctor's office multiple times a day, multiple times a week, it begins to affect our ability to respond to 911 calls. And so that was primarily the reason for making the decision to stop taking those calls. It only affected 3 facilities that we do that for, one of which is Bradley Healthcare, Life Care, and Signature Healthcare. Primarily three. We do get other similar calls from other sources, but primarily those 3. The difficulty in making that decision really lies with the fact that these convalescent calls, in most cases, are guaranteed revenue, right? They're pre-scheduled, they're pre-authorized, they're paid by insurance, and I think that's been the resistance to take a look at these code 80s or these convalescent calls in general. When we dug into the number about this specific type of call, the doctor's office visits, we found that it really only made up about $100,000 worth of our revenue. So if you look at 5.3, by cutting off those calls, by no longer taking that type of call, it represents $100,000 in potential revenue that's lost. What we gained and what we made up, besides it being, I don't mind sharing, I mean, it was a total morale buster. I mean, you sign up to be a paramedic, and then you go sit at a doctor's office every day. Like, they weren't the favorite calls, okay? So aside from it being a morale booster, it frees us up to better respond to the 911 calls, which I think everybody would agree should be our primary focus. It also, and we've yet to really see the full benefit of this, but it freed up the ladies in the office, okay? They were spending a lot of their day fielding these phone calls, scheduling, and it wasn't just a phone call. I'm Adam from Signature Healthcare. I need to schedule. No, it was one visit might mean, half a dozen phone calls back and forth. If something has to be rescheduled, if there's a change, so they were spending quite a bit of time fielding these calls and scheduling these calls during the day, when I'd rather them be focused on billing and making sure that we don't get behind. And that's a big reason why I think you'll see that number of 45 days drop to closer to 30, because that's a big piece of what they were required to do to take these calls that's now off their plate. We didn't leave these facilities high and dry. There are many, many scenarios in the past. And let me back up too and say that the decision was made, I don't know how long ago it was. We used to take these folks to the doctor's office in Chattanooga, and that decision was made to stop that. And we hoped that would make a difference, and it did. But we still, over time, have looked at these as still a challenge to try to pull off. But the we're not leaving these folks high and dry. In the past, if we've been busy, we've said, hey, we can't take that, or something's come up and we've got to take this, and directed them to call any of the private services that would love to come in and take business. And so that's how they've handled that. So we gave them enough notice. We told them this is the date that we're stopping these calls. You're free to call whoever they want. And for those facilities, they already had a list of resources that they called. So really, we heard next to nothing in terms of feedback. They understood. The communication was good, and it's been a little over 3 weeks now, almost a month, that we've not been taking those calls. We did make an exception. A handful of these calls are folks, just mom and pop, calling from their house, and they need transport to a doctor's office. And I felt like it was important to continue to take those calls. And here's the reason why. Number one, of those type of calls, it makes up a very, very, very small minority of the calls. But I felt that a Life Care or a Signature or these facilities have the manpower and the resources to schedule these calls. Mom and pop, who might just be used to calling Bradley County EMS and being taken care of, I didn't want to leave those folks out to dry. So again, back to a balance between being a service to the community and still run it like a business. That piece of that decision was made because I felt like it was more important to continue to take care of those folks that don't have the kind of resources that these facilities do, and that's primarily the reason why we continue to take those calls. But the convalescent calls, I was asked, or it was asked to me, I heard we're no longer doing convalescent calls. How can we do that? That's how we make all of our money. We still take convalescent calls. These doctors' offices were just a small minority. Roughly 20% of the entire call volume we take are convalescent calls, code 80s, transfers. So we're still taking plenty of them every day, day and night, and I don't see that will change anytime soon.
I just think you need to really look at that happy medium between freebies and business.
Yeah.
Because I think that's a critical point.
Yeah.
Sooner or later, we got to look at our system as a lot more business than free,
Yeah.
I think, because you look at your figures, you said it's never going to be self-sustaining, but it's never going to be close to if we don't really look at it as a business.
And there's a lot of calls that we go on, and like I said, we could get into the weeds on all the different scenarios. But if someone signs an AMA, meaning we're not going to transport them, we don't typically get paid for that. We have folks that frankly just abuse the 911 system. You would be shocked at the type of calls and what people call 911 for. I've personally been on a call where the person called 911. It came out as they had fallen and needed assistance. When we got there, they're perfectly happy in bed, and all they needed us to do was move their bottle of medication closer on the nightstand so that they could reach it. You think we got paid for that? We did not. That's and there's room for that discussion. Crystal would say, "What we do for one, we've got to do for all," right? But we've got frequent flyers too that call for everything, and we rarely are able to charge for that. So is it a discussion about beginning to charge a fee, a response fee, even something minimal like $100, $150? That's an option. But I will be honest with you. The folks that we're talking about are probably not in a position to where we're going to see any of that money anyway. We can't bill an insurance company for a response fee, so you're talking about a self-pay person who, frankly, we will never see that money. But that doesn't mean it's not worth exploring and looking at possibilities of how to do something better there. I agree with you.
But Adam, if you did, even though they can't pay, we did with this another one. Even if you send them an invoice and say, coming out there and moving that bottle of medicine is whatever fee it is, at least it's documented that there's an invoice. Yeah, you're right. You're probably never going to see a C note or $100,
Yeah.
but it's worthwhile from, I guess, our point of view at the
I agree.
business level to know that an invoice was sent to them, and just have to fight that off, or whatever.
Right.
But you would know those numbers.
Yeah.
Right now, you're just saying, kind of, we know we're never going to get paid,
Yeah.
so don't go with the whole
Well, and
formality piece of it.
I think there's an argument to be made too. You would hope it would also be a deterrent, even if we never see a dime on that $100. The fact that they know they're going to get a bill every time we come out might deter them from,
And then some people
stopping.
will call you and say, can I set up a payment plan?
Sure.
Like, you know, $5 a
Yeah.
week or something.
Yeah.
So I would encourage you to explore that, and I'll work with you on that.
Okay.
We will move on to D, special events.
This is, I can move through this pretty quickly unless you all have questions. So we really have special events in my mind, as we discuss these, really fall into two categories. One is PR events, public relations events. These are, you know, school visits. These are college, not college, but career fairs, you know, opportunities for us more or less to market the service, right? We don't get a lot of those. When we do, we try to take as many as we can. And I'll touch on that when we get to the budget discussion. The other is just plain old special events, right? High school football games, community events, events at Tri-State, rodeos in the community, dog shows, horse shows, things like that. What I have found is that we've not really had a very consistent policy in place for how to handle those. Meaning, sometimes we charge, sometimes we don't. Sometimes we charge a lot, sometimes we charge a little. What do we charge? There just hasn't been a consistent policy. So we've gotten to a point now where we do have something that we feel like is fair, and we break it out by for-profit and nonprofit. So from now on, and we've already begun to book events using this system, because two problems I found. One was the inconsistency in how and when and if and who we were charging. And two, when we would book these events, even high school football games, getting people to sign up for these shifts was near impossible. Now, I thought, hey, 4 hours sitting at a football game, making maybe overtime, you know, I'd jump at that. But when you've worked a 12-hour shift the night before, you're not exactly looking to go do that. So the challenge of providing an incentive or encouraging our employees to sign up was also a part of what we were looking to fix here. So what we do now is we pay our employees $50 an hour to work an event, and in most cases it's a 4-hour minimum. So you go work a high school football game in the fall, and you're going to make $200, all right, minus whatever your regular deductions are. Okay, that is higher, by the way, to give you a reference. That's higher than anybody that works over there, anybody's overtime rate, just about, maybe one or two. So it's good money, right? We've gone from begging people to pick up these shifts to we're going to have to probably start a lottery because there's so many people that want to sign up, and we're trying to be fair and consistent, right? But we on the flip side, for-profit and nonprofit, we will charge and have charged $150 an hour for a 2-man truck. We've got an event coming up in Polk County. Rally Car USA is hosting a rally car race up in the mountains. They're doing a test run. They're trying to recruit an international rally car race to Polk County. And they approached us several weeks ago. We're sending 5 crews, maybe even as many as 6 or 7 on June 15th. We would have never been able to do that if we weren't paying $50 an hour, I'll be honest with you. So we're going to be able to send 5 crews over there at $150 an hour for the truck, for a 2-man crew. A nonprofit side, and schools would fall into this category, we're charging $100 an hour. That's really only covering the cost of what we're paying the employee, right? If you think about it, we are providing the truck, the gas, the supplies, but in reality, we are even though that's the case, we are still saving money if you consider the fact that before, and I'll use the schools as an example, when we would send somebody up there, we were eating the cost of everything because we were paying. We've never charged the school system. We've never charged the school system for being at these games. But every sheriff's deputy that's on site at those games is getting time and a half, plus benefits, plus gas, plus truck, plus car. They're getting well compensated, and as they should. And so we've already had discussions, whether it be graduations, whether it be football games, whatever the school system, county and city, is aware of this. We're going to begin to charge that $100 an hour with a 4-hour minimum rate. They are obviously looking at where to find that in their budget, but to give some perspective, Walker Valley High School spent over $27,000 with Bradley County Sheriff's Office for home football games last year. In comparison, they would spend for the same set of home games $2,400 with Bradley County EMS. Now that's $2,400 that it's coming out of a football budget that's probably already tight. I recognize that, but we just can't continue. We can't continue to do it for free. And so, nonprofit, that would be church, that would be any nonprofit. We will probably still, and I don't have any specifics in mind, but there are a handful of events that we have done for free in the past, and we will probably try to still pick and choose a few of those each year to say, I think of Special Olympics. We've historically always done that for free. I feel like, especially with this new policy in place, we can afford to, if we so choose, to offer that as a free or as a donation to an organization like that. But again, by and large, we'll begin to charge everyone if they want to use our service. I won't say which school because it's really irrelevant, but we got a call asking us to come work graduation. I told them what the rate was going to be. They were a little concerned about the price, and they said, "Can I call somebody else?" I said, "By all means." Our rate was going to be $400 for graduation, and they called me back, and the cheapest quote they got was $850 for the same 4 hours. So I'm not worried about being too expensive. If anything, we're a deal. We're a steal.
Any questions on special events?
Just complimenting him on that. That's getting toward a business. Thank you.
But But you gotta weigh the fact that you use the comparison with the sheriff's deputies, their manpower versus your manpower.
Yeah, there's
When
no
they're
question.
sitting
There's 20 deputies there. I've got 2 folks.
Exactly.
So there's, yeah.
But when there's a call, there's a 911 call,
That's right.
and you got an ambulance to the end zone, they have to take off because
That's right.
you only have a dozen vehicles.
Yeah.
So
Well, if you think,
you have a different challenge.
Yeah.
I mean, on what you're dealing with as far as what you do.
schools are
versus-
required, TSSAA requires the school system to have an ambulance at football games. I don't know if there's any other sporting events or any other events that they're required to. Those are the only ones that I know. But if you think about it, there are some Friday nights when we have all three schools have a home game. We've got 3 trucks, and if it's a Friday night when Friday where we're already short-staffed, with 5 or 6 trucks to come up with an extra 3 is sometimes a real challenge. And so again, offering that incentive has been a big game changer. It's been a big positive for the crews, and it's been able to allow us, I think, to be able to provide a better service to the community that's reliable. Because unfortunately, we've had to tell some folks at some events, hey, we'll be there if we can, and sometimes we've had to make that call and say we just can't provide a truck. And so I want to be able to now say if we're going to commit to it, they're committing to it. We have a one-page agreement that they sign that allows us to bill them. And so I think it's going to be a good system moving forward.
Can I ask a question? Some of these events, I know you talked about the, I don't want to call it a golf cart, but the side-by-side golf cart that we got from Hamilton County. Some of these events, you could send that, and that's one of the main reasons for wanting to have that trailer repaired
Yep.
and being able to move it. Is those types of things, that type of equipment, something that could be at a Walker Valley or I would say probably like a Cleveland High School or a Bradley or even a downtown event that could be there to where you would be able to still keep in case of an emergency, an ambulance can
Yeah.
arrive in a short amount of time.
Yeah, it would be. That particular vehicle is not stretcher capable, so it's really more of a quick response, vehicle at a large event maybe. But certainly being able to transport it will give us the ability to offer that if that's something that an event coordinator would want us to provide. It's another layer of service that we could provide. Yes.
We'll hit training update quickly, and then we'll hit these last couple items pretty quick. I know we've been here for a while now, so.
All right, a lot of training that has been accomplished just recently. Back in April, the spring in-service, we do in-service training where everyone goes through similar training twice a year, once in the fall, once in the spring. The spring in-service training wrapped up last month. I think it was actually in April. We recently had an EVOC training, which is the emergency, it's how to drive an ambulance training and how to drive it safely, okay? Our goal is 100%. The state does not require 100%, but I do. And so we are requiring that every person that drives an ambulance be certified and be EVOC trained. And so we're working towards
Just
that.
ask, with that requirement, do we get a discount on our premium for the insurance?
I wish. No. We get a gold star, and that's probably about it. A handful of our employees recently went through just general risk management training a couple of months ago. Other trainings, I mentioned the ventilator training recently. We've got some pediatric training that's going on. There's a CPR training coming up in a couple of weeks as well. One of the things that we're looking forward to for the first time this year, we only pay for required training. There's quite a bit of training that's required, but there's also quite a bit of training that's considered voluntary, but yet is still part of what they're required to do to maintain their license, right? We don't pay for that. For the first time this year, EMS will be provided in-service training similar to what the fire department and the sheriff's department receives.
From the state.
From the state, correct. That money comes from the state. There are requirements they have to make, they have to meet so much in-person training. There's specific topics and how many hours. But if an employee reaches that goal, then they're eligible to receive $800 in-service pay sometime in the fall, assuming that they meet the requirements. And this is important because, again, the service doesn't pay them, but this will be an opportunity for some of that voluntary training that they've done to, in essence, be paid for it. So we're hopeful that the majority of our folks will be able to take advantage of that. And I think it's also worth mentioning too, and this may go back to the staffing issue. EMS is the only, we're talking about first responder agencies. To become an EMT or a paramedic, you've got to put yourself through school. You've got to pay for school. You're paying $2,000 to $3,000 for tuition if you go to Cleveland State. You're paying another $1,000 for books and uniforms. And then after that, you've got to basically work 150 hours for free for us doing a clinical, practicing what you've learned in the classroom that you also don't get paid for. Meanwhile, you can go be a rookie fireman and get paid to go to rookie school, get paid while you're training, no expenses out of your pocket, and become a fireman. Same with law enforcement. They pay you to go to the law enforcement academy, pay you while you're there, and then hook you up with a job when you're done. EMS, all of their training, all of their schooling, it's out of their pocket on their dime, and they're not getting paid for next to any of it while they're doing it. And so all the more reason why we should look at every other possible benefit to recruit and retain people, because frankly, it just doesn't seem fair. But that's the world we live in when it comes to emergency services.
Do you have a number on that? I mean, like if we were to pay for the education.
Well, we have the scholarship agreement with Cleveland State.
Now,
which,
from what I understand,
only covers
Mr.
two.
Winters, from there, I understand that's very good. In fact, he told me the other day he wanted to double it.
Yeah, that would be fantastic. I mean, you're talking about the agreement basically is that we provide, the county pays for one semester, and then Cleveland State picks up the rest. And so the last several years we've had two that have been able to receive that scholarship. We'll need to renew that agreement again before the end of July for the fall, but then we would be able to select two more as well. But I know that for the ones that have received it, it's been a huge benefit.
I would just to go on what Commissioner Blake was saying. I would love for us to see, us expand that and find a way for us to be able to do it. I think that the more people that we can help put through training, help cover some of these costs, help be able to see partnership with Cleveland State. And I've, in personal conversations that I've had with some people at Cleveland State, I think they're wanting to do it just as much as well too. So I think that it's something that is definitely needed. And I think it's something that is great for our people. You've got people who are advanced EMTs that want to move up, or regular EMTs that want to move to an advanced EMT, whatever that training is. I think it's a phenomenal thing. Anything else with training, Director Lewis? We'll move on to H, fiscal year 2024-2025 budget.
Really just to highlight a lot of this we've already talked about. The command staff vehicles in the budget proposal from the mayor. I don't know how many of you have dug into it, but a full-time assistant director is being added back in. We've really only gone, I think, 1 year without that. That's always been a position that was a part of the budget, was taken out. That position is budgeted to start in January. So if you look at the line, it doesn't look like it pays a whole lot. And even when you consider that it's only 6 months, it probably still doesn't pay a whole lot, but it's what we can pay. That position will start in January. There are funds set aside either in the EMS budget or ARP for, this is an ARP, continued building upgrades at Dooley Street. Mentioned the public relations events that we have. We are just pitiful when we show up to these events. I mean, people show up with tablecloths and swag and brochures, and we show up with a stretcher and a monitor, which some people think is cool, but in comparison, we look less than. So we've got some funds set aside.
And swag is like giveaways,
Swag
correct?
is giveaways. Yeah.
For some of the older people in the room
Sorry.
who might not know what swag is.
So some merch. We've got some money set aside to try to beef that up so that hopefully we make a better impression when we show up to these events, which in turn helps with recruitment. We've got some funds set aside to provide an additional uniform allowance. You talked about those fringe benefits earlier. In the past, we've provided $250 a year to full-time employees. When the polo alone costs $60, $250 does not go very far. And you're expecting people to have boots, shirt, belt, pants, and multiple sets of each. $250 doesn't go very far. So in many cases, these folks are paying for stuff out of their pocket. And so we're going to be able to double that to $500. Probably still not enough, but it's more than we've had before. And I think we'll be able to make a dent in providing more uniforms, at least limiting what they've got to pay for out of pocket, right? Of course, I mentioned earlier that the starting pay will be raised. One item to look at that one of the items that I found was that when I had an instance where someone came to me and said, hey, I got my paramedic's license, and all I got was a 60-cent an hour raise. Like I'm making the same after being here 5 or 6 years and putting myself through school as somebody who walks in off the street. And technically, they were wrong because the person that walks in off the street also gets a sign-on bonus. So they actually get more that year, right? So what we've done is change the policy and the way it worked, and this may turn out to be a dangerous decision, I'll be honest, but the way it worked, doesn't matter how long you've been here, where you're at, what license level you're at, when you earn that next license up, your pay raise was the difference between where you are and where the starting pay was, right? So this person was making $20.20 and got his medic's license and got bumped up 60 cents to the starting pay of where we start paramedics. I didn't like that because number one, it washed away all their seniority, and when you've got folks like these AMTs who may want to go to school, what's the incentive for a 60-cent raise, right? And some of them were less and some of them were more, right? What we've done instead is if you're an AEMT, you will get basically what equates to a $2.96 an hour raise, which is the difference between the starting pay of an A and the starting pay of a paramedic. So if you've been here for a year or you've been here 10 years, if you're an advanced EMT and you go get your paramedic's license, you're going to get roughly almost a $3 raise. That will be determined always on the difference between the starting pays. If you're a basic EMT and you get your A, it's about $1.50 difference, and so that would be your quote raise. I feel like that was important both to encourage people to to push themselves and provide an incentive to go to school, but also it's a recruitment issue, or I'm sorry, I think it's a retaining issue. And so why I say that could be a dangerous decision is that's not necessarily how the budget was structured, right? So we'll obviously have to watch some of those lines as we get closer to the end of the year next year, but I think it's going to be a good move for us. Obviously, I mentioned this earlier. Looking ahead, some priorities. Obviously, we've talked about the replacement cycle for trucks, and potentially, hopefully, maybe at this point next year, talking about adding positions back in because the vacancies are full. But the other thing that if I'm still around in any capacity, that I want to put on the table now is we desperately need a full-time training captain. We have someone who's serving in a part-time capacity that does a tremendous job. She works for us part-time. She teaches at the college. She's plugged in. She's engaged. But you could put Superwoman in that position part-time and not get out of Superwoman what we need to really be able to serve Bradley County EMS to its fullest capacity. Other departments have a full-time training captain. You think of fire. There is plenty to do year-round for a full-time training captain at Bradley County EMS, and that'll be something that I hope we can address and look at as soon as next year's budget.
Any questions? We'll move on our last topic for today, letter I, the Hamilton Medical Center purchase. I know there's been some questions about what that will do with EMS, for EMS, and kind of what that kind of change and hospitals will do. And I know that you've had some conversations and just kind of get some updates on it.
So I'll just talk briefly, and then I'll let you ask any questions that you might have about it. I've had several meetings. I think the first was myself and the mayor with their top leadership. I've had some separate one-off conversations with them as well. There's a lot that they can't talk about until later this month when the FTC completes their review of the sale of the property. Okay, I believe it's August 1st is the transaction day. That's their go live day. So you're talking about August when they would officially take over at our location. I don't think it's private, but the working title will be Bradley Medical Center, which I think is amazing. I think that's a great thing to be able to bring Bradley back into the name of the hospital here in our community. But I was asked almost immediately after the announcement by really starting with our folks, what does this mean for us? Because as many of you may know, they have their own private ambulance service. They essentially run the county ambulance service there in the county that they're in down in Dalton. And so, I was asked, what does that mean for us? What does that mean for our call volume? And as we've had a chance to talk with them, I think in the first meeting the mayor and I had, I specifically asked, how do you envision the relationship between your hospital and Bradley County EMS? And the response that I got was immediate, and it was, we are open to whatever you want that relationship to look like. In subsequent conversations, I flat out asked them, are you planning to set up shop? Do you want to set up shop? No, they don't. Frankly, they've got a heavy lift for the next 18 months. And all they're going to be worried about is getting their hands and their arms around what they've just bought here, right? So they're not focused on that. They want to work very closely with Bradley County EMS. They want to know how they can help us, which I think is going to be tremendous. We've not always had the equal partnership from corporate at Tenova, and you all know that's been a challenge. So on a very basic level, I think it's going to. Number one, I think it's going to be a great thing for the community. I think it's going to be a great thing for the folks that work at that hospital, and I think it's going to be a great thing for us. In terms of what it might do to our numbers or the service we provide, I think we'll see our transport numbers go down because they've indicated that they are going to raise the bar on the services that they offer at the hospital, which in turn will keep more people in that building that we won't have to drive to Chattanooga and to surrounding hospitals, right? One of which, I mean, they two things that they have been specific about. They intend to raise their cardiac game significantly, and if they're able to keep more people and treat more people at a cardiac level here in Cleveland, that's going to mean less transports for us. Just that one area alone. They've also indicated that they would like to, that their goal is to be trauma rated in the ER. What does that mean? Typically you hear about level 1 trauma, which is Erlanger, right? Best of the best when it comes to emergency rooms. But there's subsequent levels all the way down to a 3. And so even simply being trauma rated 3 is going to mean that they're able to do more, take care of more people that we don't even blink driving past the hospital here to take to Chattanooga because we know that they can't take it, right? So I think that will be the probably the more noticeable impact. And again, that won't be overnight. It'll be some time before I think that they can achieve those goals. But in terms of them wanting to sort of set up shop, you know, I don't mind saying that, you know, number one, we're a closed county, right? Nothing will happen without the expressed permission of the county. And we went through this most recently when we gave Amerimed permission and have a contract with them to come in and do the mental health transports for the sheriff's department, right? You'd be talking about something similar type of discussion, but on a much larger scale. They can't just set up shop. Even if they've got ambulances down there, they can't just roll across the state line and start transporting people. They have to have a license. It's a different state, different rules. They're licensed in Georgia. They're not licensed here. There was some discussion about whether or not they can move patients from hospital to hospital, right? From here to there, or vice versa. According to our state's EMS board, they can do that as a one-off, but as a regular occurrence, no, they would have to be licensed, and again, that would fall then back to us.
And what about us?
Well,
Are we, as Bradley County EMS, able to transfer patients from
absolutely
Bradley County to Whitfield County, Georgia?
Absolutely, and I think that will become more of an occurrence. If you think about it, you know, it would take about as long to drive down Dalton Pike emergency traffic as it does to get to Erlanger, downtown Chattanooga. So you're not really adding any time difference. You know, our protocols, regardless of what the hospital would like us to do, yes, they'd probably like us to take as many patients down there as possible. But regardless of that, decision will be made based on our protocols, which state that in almost every case, we're taking a patient to the nearest, closest facility to treat whatever it is that their complaint may be. So that if it so happens, or if it's a non-emergency transport, if it so happens that it's Hamilton Medical Center, then we can and we'll do that.
And that would also fall on the convalescent transfers as well.
That's correct. Yes.
So, yeah, real quick. So, as you talk to them, they have no plans of, since they have their own system, so to speak, of providing that right now, or even asking for it.
No, I mean,
how, I don't even see how it could work.
Yeah.
Get a call from 911 over there on Country, and they're not going to say, well, do we call the
Right.
hospital or do we call EMS? It's always EMS. EMS is the one, we're county-wide. There's not a city EMS and a county EMS.
it wouldn't make sense, and honestly, and not to put this out into the atmosphere, what would probably make more sense, and again, this has not been discussed either. In fact, I asked about this, would be them offering to purchase and buy Bradley County EMS and take over the service, right? That's not on the table. Now, I was told, hey, if that's ever an option, we'd like first right of refusal. I mean, they want a phone call, right? But that's not their goal. That's not their intent. And so, you know, and I'm not scared or worried by that response. I would say the same thing. I mean, if we're going to sell, I'd like, and I've got a hospital here, I'd want to talk to you too, but that's not their intent. Like I said, they've got 18 months to 2 years. Their focus is on the building, on raising the bar, on providing better services for the community. It's not.
And that's not our intent either, correct?
Yeah. And that's correct. Yeah, we have.
I said that is not our intent
We have
either,
no intention
correct?
of selling either.
Make that very clear.
Yeah.
Are there any other questions? And I don't think there's any other business to discuss. Anybody have anything? Commissioner Collins, anybody? By law now, we do have to ask, is there any communication from the audience? I know there's some people here. Is there anybody here that would like to speak? Yes, ma'am. If you would mind, if you would come to the mic, so the people who are possibly, and if you would please state your name as well for the record. I think, is it on? Might have a timer on that.
You guys hear me?
Yes,
Okay,
ma'am.
cool. My name is Amber Kahn. I am a part-time paramedic at Bradley County EMS. I was full-time for 5 years until September, when I went part-time, mostly just because it benefited my life more. It also came with a bit of a raise because I went from making 23 and some change an hour to 25 and some change an hour. I'm still here because I care about Bradley County EMS, and I do feel like this is the best service in the area to work for. So when we were talking about this, anytime we talk about Bradley County, it always gets put up against Hamilton County because that is the closest county to us that's most comparable. Now, I understand there is a big difference between Hamilton County and Bradley County. So I just kind of looked up some numbers. We were curious about it. The population of Bradley County, according to last year, was 110,000. Hamilton County was about 300, close to 375,000. So that's a huge difference there. There's also a big difference as far as square footage for Bradley County versus Hamilton County. According to Hamilton County's EMS website, they ran 40,000 EMS calls last year. We ran 28,579 last year. This is a little bit different because Hamilton County has 17 ambulances, and they run 24/72. So at any given time, if they are fully staffed, everyone is in service, they have 17 ambulances available to run those calls. We are running not much more, than about 10,000 calls annually, and fully staffed, we're running that with 8 trucks. Again, they pay the 25 and some change an hour. Start out at 20 something. So then you mentioned, was it Greene County, North Carolina? Greenville, Tennessee. Okay. So then I don't have the numbers for that. I don't know how it compares. But again, the people in this area, when they talk about working for a county service versus a private service, the two they're comparing are going to be Bradley County or Hamilton County. Other than that, they're going to work for a private service.
If you don't mind, can I ask you a question? And
Yeah.
this is for anybody. What other county services, I would say within like 5 or 6 counties around, is there? Just for my knowledge. Like
Ray County.
Ray
yeah.
County,
Ray is
McMinn?
actually private. So they're called Ray County EMS, but they are actually technically a private service. You've got
And then
Meigs County. They
Meigs.
are a true county service. They have, 2 ambulances? 1 ambulance, I'm sorry. So anytime they run an emergency, we're on standby for them. Polk County is also private now. They have 3 ambulances. We also go on standby for them if they have an emergency. Anything that requires more than 2 trucks, they need our help, and if we have it, we give it. There's McMinn County. They're private because they're AMR, and they have 6 trucks. They only run 911 calls. They do not do discharges. They do not do transfers. They do not do anything outside of a 911 call.
And their patients don't ask to come to Bradley County like our county
Well,
residents
they
ask to go to
do.
Hamilton
They do
County.
come to Bradley County. We do have
Well, that's what I was
Hamilton
told,
County
is that
ambulances transporting.
A lot of our good folks ask to go to Hamilton County relative to the number of Hamilton counties who ask to come up here. There's some,
Right.
but not
Well, and
near.
Hamilton County has 7 hospitals to transport to. So their wait times at any given hospital isn't going to be comparable to us going to Tenova. But running emergency traffic in our fastest trucks, so you got to take the internationals out because they're capped at 72 miles an hour on a good day. Plus, you need to add in all the construction on 75 and 24 prior to the construction. And if you're not in an international truck, on a good day, you can make it emergency traffic from the general city of Cleveland to Erlanger in about 32 to 34 minutes, which is decent, but that's not the case anymore. So oftentimes now when someone needs to go south and we really need to save time, we have to fly them. Or you're looking at like a 45-minute plus transport time. And again, that's depending on what truck you're in, because the internationals, when we get on the interstate, we have to shut down the lights and sirens because we can't get them up to an appropriate interstate speed, much less an appropriate emergency response speed, so it confuses people. We shut it down, and we drive as fast as we can to get there. So I know that we say that we're not comparable to Hamilton County, and I understand that as far as numbers and population. But we are running somewhat of a comparable call volume with half the amount of resources. And, you know, I'm probably partial. I think we're doing a pretty good job of it. So that's why we compare our benefits and our pay to Hamilton County. Because when people are looking for a county service to work for, they are comparing Bradley County to Hamilton County. Also, the clinical hours required for paramedic school, and this is only paramedic school, so this doesn't include EMT. You need 3 semesters for EMT. Then you can apply for paramedic school. That's going to be an additional 3 semesters. So 6 semesters total, which is about the same amount of time that it would take you to get your associate RN. For a paramedic program only, you're looking at 616 hours of clinical hours. 616 hours of free labor. And that's going to include, you know, like your rotations with OB and in the ER. We do one with the stroke team. We do one with medical ICU and trauma ICU. Your last semester, you have 20-something that are specifically on the ambulance, and you are in charge of those calls. If for some reason you fail one of your last 4, you have to repeat all 23 of those last 12-hour clinicals. It's a significant amount of time that people are donating for something that they, you know, believe in. I don't think that you do this job for the money necessarily.
Thank you, Ms. Khan.
Yeah.
Is there anybody else that would like to speak? Yes.
Try to make it short. I know everybody's probably ready to get out of here. I just wanted to say my name's Hunter Shifley. I've worked for Bradley County EMS since 2017. I moved here as a paramedic from Ohio. Bradley County has really become my home. I have worked under 3 different directors, and I just want to say I know he's interim, but Adam has made probably the biggest change to Bradley County EMS that has ever happened. I know that the attitude is better than it's ever been, and it is actually upward sloping, which is a big deal. If you stop by a station on any given day in the last 7 years, that's a big deal. I just want everybody to know that we appreciate Adam, everything he's doing, everything he's trying to do, and I don't know if he wants the position, but we would like him to have the position. So that's all. Thank you.
Adam, raise your right hand.
Is there anybody else from the audience that would like to speak? Yes, ma'am.
My name is Ashley Bomboy. A lot of you know me as kind of Adam's right hand in the EMS world. I'm uniquely qualified with a different perspective in that my husband works for Hamilton County EMS as a paramedic. So I see a lot of situation with Hamilton County, and I work for Bradley County where I have firsthand experience with all of these guys. So my husband recently had a call with a patient where the patient asked to come to Tenova because they are from Cleveland, and it would have become too costly for their family to come down to Erlanger or Memorial or Park Ridge. So they asked, can you please transport me to Tenova? And Hamilton County protocols required him to say, I'm sorry, but we can't transport you to Tenova. It's too far. So this community has been, I'm sure you guys can attest how many frustrated patients we have because we have to send a patient to Tenova. We can't take them to Erlanger just because they want to go to Erlanger, Memorial, Park Ridge. So, I just wanted to let y'all know that the protocol for Hamilton County is the same, only, the different hospitals. Um, so, the community's complaint that, we don't have accessibility to bring them to Chattanooga, it would be the same in Chattanooga. They don't have the accessibility to bring them here. The other thing I want to say is how proud I am of Adam, not just because of what he's doing with the finances or with the communication with downtown, but to see him giving of himself to these guys. There have been times where I have come in the morning and he's been sitting in the bay just talking to guys. What do you guys need? What do you guys want? Like getting to know them, getting to know their situations. He's come on Saturday mornings and made breakfast for crews. He knocked EMS week out of the park. EMS week has always been kind of a bummer. Hospitals have done stuff, but EMS, Bradley County EMS as an entity really didn't do anything to celebrate these guys. And Adam had something every single day where he was just letting these guys know how grateful he is for their service. So I'm just really proud of what Adam has done, and I'm really glad that I get to be a part of it.
Thank you. I'm disappointed we haven't got an invite to Saturday breakfast yet, but that's about it. But is there anybody else that would like to speak? Seeing none, I would like to take and we've been here for a really long time, so I will make it short and quick. And I'm saddened that Miss Stewart left, that Commander Stewart left. But there's two people here. There was three. Maddie Jones, Paramedic Jones, and Commander Taylor. I want to personally say thank you. Sorry. It's a very scary situation in my family, and you guys are amazing and took care of my daughter and took really good care of her when she needed it the most. So thank you so much for what you guys do. I've got to experience it and see it firsthand, and I can't thank you guys enough. And I truly do believe we can talk all day long about Hamilton County or McMinn or one of these other places, but there's nobody better than you guys. And I truly believe that. I think that you guys care about our community. You care about giving the best care possible day in and day out. And I just want to say thank you from the bottom of my heart because I've experienced it firsthand. So if there's nothing else from this committee, motion to adjourn.